Yes.
Hi, Sovereign. How are you doing?
I'm okay.
I'm Abby. I'm going to be your nurse today.
Okay.
All right. Can I see your wristband, please?
Sure.
Thank you. And then your name, your first name and last name?
I don't know. Jennifer Hoffman.
Okay. And your date of birth?
5/31/88.
Okay. And do you have any allergies at all?
Just seasonal.
Okay.
Nothing with medication.
Okay, good.
I don't want to be here.
I will try and talk to the doctor and see what we can do for you.
Okay.
But your blood sugar is a little high, so we are going to have to give you insulin.
Okay.
Okay. So, but you take insulin quite often, right?
Yes, every day.
Okay, just making sure. All right, so at this point, I am doing hand hygiene, and I am also reviewing my medication rights. So I have right patient, right dose, medication, time, route, and documentation. So I've performed hand hygiene, so now I'm going to go ahead and put on my gloves. Okay.
I like to be stuck on my left side of my belly.
Okay, sounds good.
Okay.
All right.
Can we get this going?
We will do it. Okay, so according to the MAR, we have to give 3 units of insulin. So I'm gonna go ahead and get my syringe opened up. It's ready to go. Great. And then I'm gonna take my wipe, which this will be brand new, but we're running low, so brand new wipe. And then, so we're gonna go ahead first and we're gonna wipe the patient. So this is going to be in her abdomen. We're gonna go ahead and we're doing the left side. Okay. And then we're gonna go ahead and wipe the vital. Alrighty, and then we're gonna go ahead and take our insulin syringe, and we're going to be drawing up 3 units. And pull 3 units of air. Okay, and then push the air in there, and then draw the medication up. Make sure there aren't any kind of air bubbles or anything, which there isn't. Okay. Looks good. Alrighty, you ready?
I guess.
Okay. So we're going to be squeezing the tissue, the subcutaneous tissue, and this is going to be on her left side because that's what she prefers. All right, and then quick, we're going to be at a 45-degree angle. Quick dart. Hello. The doctor was coming in. Okay, and then we're going to aspirate just to make sure that we aren't in the like we're not getting any kind of blood. Okay. Push it through slowly. Okay, keep it in for just a second. Pull it straight out.
Didn't hurt.
All right.
Felt great.
Glad you liked it. Okay, and then we're going to recap our needle. Great. Okay. And then we're going to go ahead and get our trash out of the way. So this will go into the sharps. And then we're going to take this trash out of the way here.
I'm so done with this. I want to leave.
Okay, well, I'll do as much as I can for you, but I do have another medication for you, but it's going to be in your muscle. Is that okay?
Okay.
Okay. So, are you familiar with Zyprexa or anything?
Yes.
Do you take it quite often?
Yeah.
Okay, just making sure. All right, so then I'm going to go ahead and wash my hands again. All right. I'm going to get some gloves on. And I've already checked the dose, medication, and everything, but we are going to be giving, according to the MAR, we're going to be giving 1 ml. Okay, and then I'm choosing my site, and it's going to be the glute. So, all right, so I'm going to be giving you a shot in your butt. Is that okay?
I'm normal. Yes.
Okay.
Yes.
All right, sounds good. Okay, so now we're going to open up our wipe. We're going to wipe the patient. We're going to wipe their glute. So we're going to go in a circular motion. Get it cleaned up. And then we're going to get our vial. Clean our vial. All right, looks good. Get that there. And then we're going to open up our syringe. All right. IM needle. Okay. And then we are going to be giving 1 ml, so I'm going to go ahead and pull up a ml of air. Alrighty. Push it in. Push the air in. Alright. Now we're there's not any kind of bubbles or anything in that. Alright, it looks good. Alright, we're at the mill. Now, okay, and then now we are going to go at a 90-degree angle, and we're dart, and then we're going to use the Z method just to pull the skin taut, make sure we're getting into the muscle. So quickly, throw it in there, push the medication slowly. We're just kind of checking on the patient, making sure they're okay, which, are you okay?
Yep.
Sounds good. Keeping it in there for just a second. I'm gonna go ahead and pull it out quickly. All right, and then they could be bleeding, so we wanna make sure that they're not bleeding, and if they are, we can hold some pressure with either our alcohol wipe or like gauze or something. So pressure, we're not massaging it or anything like that. And then, they're not bleeding anymore.
Feel great. Yeah, that was good.
All right, so now we're gonna go ahead and get my trash out of the way. All right. Miss Hoffman, do you need anything else right now?
No, leave me alone.
Okay,
Leave
sounds
me
good.
alone.
Your medication
Turn
will
the
be
lights
coming in
off,
here soon.
please.
All right.
Thank you.
It is now nighttime. So, now I'm coming back into the patient's room, and I'm going to be giving her blood pressure medication. All right. Hi, Miss Hoffman. How are you doing?
I don't know. I want to be asleep.
I understand. Well, I do have some blood pressure medication for you. Is that okay?
Yeah.
Okay. So let's perform hand hygiene once again. Okay. And throw on my gloves. Alrighty. And then, according to the MAR, we have to give 50 milligrams, and we only have available 25. So we're gonna give 2 times. We've got some water here for her. Alrighty. So I got some water here for you to take some sips.
Fine.
I know, I'm sorry. Here's your pills. And those are opened at bedside, by the way. We're not going into the room. Alrighty, how'd that go down?
Fine. Leave me alone.
Alright, sounds good. You get you some rest. Let me know if you need anything, okay?